So I was not confident in gait analysis coming out of uni as a young podiatrist, and I started to notice this trend amongst other young clinicians, particularly podiatrists. And this is how the gait movement really began, because I started to focus my learning and development in this area, and then I wanted to share with other clinicians what I'd learnt in one little nice platform that is like a little go-to Bible, and help all of us regain some confidence in this area that really should be one of our niches, and improve the profession as a whole and improve patient outcomes. So is gait analysis important? Yes, we certainly like to think so at the Gait movement. Let me explain why, and perhaps change your perspective on a few things if you are not already currently convinced. So, networking and referral pathways. Gait is a big reason for referrals coming into podiatry. GPs or other allied health professionals have noticed something unusual or uneven in someone's gait, and they refer to podiatry for our opinion because we are the gait experts, and so we should be. Exercise physiologists, you are movement experts, so you need to be across a wide range of movements, from in the gym setting, various sports, but also running and walking gait. Now, if gait analysis isn't an area that you're really confident in, at least know when things don't look right, unusual, uneven, and find yourself a good podiatrist to refer to who is confident in this area. And this creates a holistic approach for the client with different perspectives, treating from the foot, you treating from the strength program perspective. But it also starts to generate a trusted network for you to refer to and learn from other allied health professionals. Now, physios, your skills cross over a bit with pods and exercise physiologists, but I'm sure some of the reasons I've mentioned above resonate with you too. So gait analysis can be a great referral pathway both ways, and it's a reason to justify your referral. MSK Assessment. When a client comes into your clinic room with pain from an injury, when do they experience that pain, and how did that injury occur? I bet it didn't happen when they're lying on the couch watching TV. Generally, it's going to occur when they are weight bearing in some sort of movement, and walking or running is a very common movement pattern that they are often going to experience pain in. So we need to look at these movements to assess and move forward. Let's take knee pain as an example. Now, let's all imagine this guy walking. He's going to have a very typical gait for knee pain. It's going to be a bit of a hip drop, the knee turns in and the foot collapses into pronation. Looking at this gait, straight away my mind goes to, okay, we've got a hip drop, the glutes aren't strong enough to stabilise the hip, and that's also dropping the knee into that valgus rotation. Then down at ankle level, he might also have an abductory twist. That would be a really common indicator of a bit of ankle decreased ankle range of motion. But even if he doesn't have an obvious sign, I'd be testing ankle range of motion. Loss of ankle range of motion is then often compensated into the path of pronation. And then of course I'll be assessing foot posture for that pronated foot type. So straight away I'm testing glute strength, glute function, ankle range of motion, and foot posture. 4 tests. 4 tests for this individual that are tailored to him and his presentation. It's wiping a bunch of other tests off the table that are unnecessary for me to do, and it's much easier, more efficient, and less confusing than starting with a massive template of various clinical tests that you need to do on every single client, half of them being non-weight bearing and not even that functional, and then being really confused at the end. You've done all these tests and you've taken so long, surely you must know the answer by now. But half those tests weren't even really relevant to the problem. Gait analysis can help us simplify our next level of testing for the individual client and really tailor it. Another point out there for the pods, foot posture in standing versus dynamic gait can be quite different, so it's important that we compare these, especially if you're doing an orthotic prescription. If you don't feel confident to use gait analysis to guide your assessments, then check out our foundations course and live workshops, because these will run you through exactly how to do this with many more examples and help you be ready to use it practically in your clinic. And on the note of referral pathways that we talked about before, EPs, this is the perfect client for me to refer to you for a bit of hip strengthening. Client education. Gait analysis is a great way to bring your client on board with your treatment journey and show them that you know what you're talking about and gain their trust. So let's take the knee pain client from before. Okay, Joe, so what I'm seeing here is your hips dropping, so your glutes are not strong enough to lift that up while your leg swings through, and and that is also causing that turn of the knee inwards, and that's creating more medial force down that side of the knee. And then at foot level, your arches are collapsing, so you need some arch support. Notice how if I roll my feet in, my knees turn in, and if I roll my feet out, my feet turn out. Sorry, my knees turn out. So to fix this, we're actually going to put an orthotic underneath your foot, and we're going to give you some glute strengthening exercise to strengthen your hips. And that together, in turn, is going to help the alignment of the knee and help your knee pain. All of a sudden, Joe goes, that makes sense. Even though the treatment isn't directly at the knee, I see the method to Estelle's madness. And using this method is very effective with clients. Bring them on the journey, show them, video their gait, show it back to them, demonstrate yourself, anything like this. Bring them on board so they really have an understanding and trust your treatment, and I think you'll get some better compliance. So practicality. How complicated does gait analysis need to be? In my opinion, not very. For the bulk or the majority of the information you're going to get out of gait analysis, a standard hallway or treadmill gait analysis is more than adequate without any fancy whiz-bang equipment. And even with that fancy equipment, I often feel that still the clinician is doing most of the analysis and maybe not so much the equipment. Depends on your interpretation. Maybe there's some super fancy stuff out there. But for the average client and the average clinician, unless you're working with a particularly elite cohort that are going to pay for extra fancy analysis and things, that's going to take you forever to set up in a consult, hallway or treadmill is the way to go. Be aware with any of those fancy equipment things, with various things prodded on people or something under their foot in their shoe, or even with treadmill analysis, people's gait will be modified if they're not comfortable. If you're working in a gym setting and have access to a treadmill, and clients are used to that setting, they're more likely to be those clients who are used to being on a treadmill. So great, use it. Treadmills are great for assessing sagittal plane and particularly the running cohort, because most hallways are not long enough for a running gait analysis. However, you're going to get that cohort who have never been on treadmill before or just not confident on it, and they're really unstable and their gait looks really awkward and it's really not natural and it's not an accurate assessment. It's also a falls risk, so let's avoid injuries in your clinic. So for the most part, I would just recommend standard hallway analysis, film it to show the client back afterwards, great for client education of course, and then also for you writing notes later, if you haven't had a chance to write your notes and you've got another 5, 6, 7 clients by the time you write your notes and you've got everyone's gait confused in your head. So good for refreshing, and then optional if you want to have a look at testing a few apps, free versions or paid versions. You might find something that works for you as far as drawing various angles on the video. But keep it simple, stupid, especially if you're just trying to hone in on your own gait analysis skills and become confident in gait analysis and not relying on technical equipment. So yes, we definitely feel at the Gait Movement that gait analysis is very important. If you would like to improve your skills in gait analysis and make it a more functional, useful part of your assessment, then check out our courses. Our Foundations course would be the perfect place to start if you're not very confident or haven't had much experience in gait analysis.